Very quickly, this is just another example of what I often see with shoulder CT, which is not the correct way to prescribe the planes for the CT scan. And I'm not going to be able to give you the normal appearance on this study, but I'll show you the wrong appearance. So the axial images are required as usual, just cross sections that are orthogonal to the tabletop, and this is what you're going to start off with. Now, based on this, you would want to reconstruct the coronal and sagittal planes, but what you can see here is that this sort of coronal plane, if you look at the line on the axial images as I scroll through the coronal images, they're just coronal relative to the tabletop. They're sort of parallel to the tabletop. But the tabletop is not the reference position we should be using. That might be the case if you're doing abdominal imaging or even brain imaging perhaps. But the joints are obliquely oriented, and you have to adjust your imaging planes appropriately. Similarly, with the sagittal images, as I scroll through these, look at the cut line here on the axial. You can see that the line is just perpendicular to the tabletop. Again, that's incorrect because it results in these oblique-looking images that are sort of, you don't kind of get the anatomy as you ought to be getting it. And the way you correct this, and the way you're supposed to be doing this, is using the axial images to prescribe your other planes. You draw lines that are either parallel to the glenoid surface, which results in something that resembles a sagittal image of the shoulder, or something that's perpendicular to the glenoid surface, and that will result in a coronal oblique image that's actually like coronal to the shoulder. And that's what we're looking for when we do these studies.